Okay, now I want the panelists for today to make their way up here, please. And while you're doing that, I'm going to go over a couple of points that Senator Cruz sent. Jason could not be here today. He was booked. Jason Wright, the East Texas Director. Y'all, don't be shy. Come on up and take a seat wherever you want to. Jason was already booked somewhere, but he said that regarding Obamacare, the president's "if you like it, you can keep it" promise has been repeatedly proven false, as we already knew. If the law continues to be implemented, more and more will lose their health care and their insurance. Premiums will continue to rise, and Americans will begin to lose the doctors of their choice. And when the employer mandate that was waived finally goes into effect, millions of Americans will likely lose their employer-sponsored coverage as well. Senator Cruz continues to advocate for full repeal. And I will tell you that Senator Cruz and his team have been working on a solution to the problem. And that will be rolled out pretty soon. And they absolutely have gone to healthcare professionals and to people in the insurance coverage industry to look at where things are broken and how government can best get out of the way. Okay, now we have a great panel here today. We have State Representative Matt Schaefer is going to talk to us about the many times we had to fight and beat back people, including Republicans who wanted to expand Medicaid under Obamacare. He's going to take up that issue. We have Jonna Fitzgerald today. Jonna is with Representative Gomert's office. You've seen Jonna around many times. That she is his district director. Then we have Dr. Ron Beals. And Ron, I was thinking about you today. I think Ron is one of the charter members of Grassroots America. And he spoke about, helped us fight Obamacare when we were first rolling out our lawsuit. And then we have another member of Grassroots America, Dr. Margarita de la Garza Graham, who's going to speak to you today from the perspective of a healthcare provider, and I'm sure she might add a comment or two from her husband, Dr. Thomas Graham. So I'm going to put this mic down, and I'm going to let them decide the order they want to go in. What I want you to do is to be getting your questions ready on your cards. Now, I want to say one quick thing about Congressman Gomert. Congressman Gomert is going to need you to put your specific questions for him on cards. We're going to hand those to Jonna, and she's going to take them to Congressman Gomert so that he can answer you. Jonna's not going to answer policy and legislative questions today, but she's going to give us some perspective about the kinds of calls and constituent concerns that she is hearing in Representative Gomert's office. So now give them your good attention and make sure your phones are off. Okay.
Good afternoon. Is this on?
Nope.
Okay. Switch. Good afternoon.
There you go.
Okay. Best way to solve any problem is to look at what caused the problem. And Obamacare is a problem for everyone in this nation, including those who have enacted it. I'm probably the oldest white-haired person on this panel, and I want to look at things from a little bit of a historical perspective. I think to start with, however you solve a problem, you've got to look at what caused the problem. First of all, I've been through the Bible about 30 times. I have yet to find anything that says health care is a right. I've been through the Constitution at least 5 times, and I don't find it listed as a right there. Now, if I am a nice person and a good person, I personally will want to do something for those who are in need. But I have no right to impose that concept on anyone else in this nation. So I have no right to enact a law that literally mandates you give up yours for someone else. That's the critical issue as far as I'm concerned. Secondly, I started medical school in 1967. 67 was the year after ObamaCare, after Medicare became a fact. And I went back and I've looked, and I remember in 1986, a wonderful woman who was a physician in either New Mexico or Arizona, wrote a little letter to the editor in the Journal of the American Medical Association, JAMA. Because in 86, healthcare costs were really getting out of hand. And she wanted to look at what caused this problem. So she did a little research and looked at healthcare costs over time. And the thing that this woman identified was prior to Medicare, healthcare costs were relatively flat. They weren't totally flat, but the increase in healthcare cost was relatively small year by year per capita. After the advent of Medicare, healthcare costs skyrocketed. Why did that happen? Why would I want a Chevy when I can have a Cadillac? And as a physician, why would that happen? Because my patient's not having to pay for that, which is a very erroneous thought. Your patient is paying for it indirectly, maybe not out of their pocket directly that you can see. And as a result of that concept, the erroneous concept, the American public literally started demanding a quality of health care that was beyond our means. And as is often the case, we are living beyond our means. When you actually look at it and you start checking dollars, in 1950, the per capita cost of health care was $91.67 per year. That's how much people were spending. In 1964, they were spending $131.13 per year. That's in 1965 dollars. That's an increase of $43 over 14 years, roughly 3% per year. Now, with the dollar being devalued as it has been, the $131.13 converts to $147 when you go to 2010 dollars. So if you go back and you look at it, in 1960, the cost per capita was $147. In 1970, it was $356. That's a 142% increase in 10 years, or 14% per year. In 80, it was $1,330, which is a 27.4% increase. That was when they started recognizing that there was a huge problem, so we started doing more government controls. So when government got into the business and became a third-party carrier, that's what literally disrupted the normal economic forces and why we got into this problem. Because I am no longer responsible to pay my bills, somebody else is. That means costs increased, and then you end up with the last big issue, which is corporate medicine. I was very fond of my family doc when I was a kid. Chester Thomas Johnson was fabulous. I'd get a sore throat, I'd pay $5, he would give me a shot, I would feel fine. Most of the time he came to my house. Okay? Now, that was a professional. Little old ladies went into the office, they didn't have anything, but they gave them a box of cookies at Christmas. Or something. And if they got really bad, they went to the hospital, and there was some sort of a relief program for them. When you get into corporate medicine, the dollar is the most important, not the patient. I really loved being a physician. I still am a physician. And I was a darn fine one as well. However, I am thrilled that I am no longer in the healthcare business, because it's now corporate business, because it is no longer the same business it was, and the level of professionalism that we see, particularly in the corporate entity, is not near what it was even 10 years ago. Thank you.
I have to agree with everything that you said. The practice of medicine has changed, and I think a couple of points that I want to make is about about your physicians here locally, and I said this the other night at one of our meetings. Physicians here locally are by and large against Obamacare. And we see it as a huge imposition. Now, the very first thing to say is, if Congress exempts himself from this, then why is it such a good thing for the rest of the American people? That tells you something. But more to the medicine side of this, the AMA, the American Medical Association, probably represents about 11 or 15% of physicians across this nation. Not very many. And I'll tell you that the majority of the physicians who are part of the AMA are those of us that are in training at the universities in the academia world. And the AMA wholeheartedly supported this when the majority of us physicians across the United States who are in private practice or out here in the rural world were completely against it. So they have something to answer for, and there are some very, very powerful letters that are out today, right now, pointing to the AMA as to how are you going to answer, how will you respond to what you did and what's going on now. You were promised this. We were promised, because and I know you guys, a lot of people say, well, physicians are so rich that we have not had a pay increase in 25 years. In fact, our salaries have dropped more than 50% in the last 20 years. Everybody gets their cost of living. My malpractice insurance, except in Texas because of tort reform, we've done well, but everybody else's malpractice insurance continues to go up. The cost of living goes up, the ink, the electricity, everything else does, but our payments continue to go down. And it's a shame and it's embarrassing and it's so sad sometimes when I open up a check and it's for $47. I'm a surgeon. I operate on people. I'm a physician. I'm a healer. And this word provider, we just hate that word. We're not providers, we're healers, we are physicians. So there are some panels, and Ted Cruz is one of them. There are also other medical policymakers that are trying to get together in Washington so that when this does, and there's nothing, we have to repeal it. And this repeal and replace, I'm not sure about the word replace, but repeal. And then the things that we have to focus on, as Senator Cruz talks about, is why can we not purchase insurance across state lines? What is the problem with that? And of course, it has to be the bottom line. There's got to be some politics involved in that. But that's the one major thing. Young people really don't want to have health care insurance because they want to buy boats or cars, and they want to do something else. They're healthy. They're immortal, as we all were at that age. They don't want to get health care. So maybe the education of the youth is going to be very important, and having them understand that maybe just having if something catastrophic were to happen to them, and health savings accounts, where that is their account. There's so many things. So if you take the whole population of the United States, and you knew 4 years ago or 3 years ago when this chaos began that 85% of us were covered in some way or another, whether it was a VA or Medicare or Medicaid or some form of insurance that 85% of us had. Why couldn't we take that 15% and just focus on those folks and say, okay, what are we going to do with these folks? Well, we do have Medicaid already and pre-existing. Everybody talks about, this pre-existing. A very tiny percent of the population actually has pre-existing. Well, what's wrong with using Medicaid for that small segment of the population and leave the rest of us alone? So those are things that we have to continue to focus on. I'm not sure what else I want to say, but I agree with the legislature not having increased the Medicaid. We're not going to have the funds for the Medicaid. I'm sure the representative will discuss this, but Medicaid would have been an option for that small segment of the population. So it had nothing to do with the best health care in the world. The best health care in the world, the best physicians, the most generous physicians, because we're the ones that take care of the world, doing mission trips all over the world. There are no more physicians more generous. And we always took care of our people locally. If someone didn't have something and they wanted to bring us cookies, that was perfectly acceptable. I have gone to many folks' homes myself. So that is going away. That is going away as this becomes the monster that we are seeing develop. So we must repeal it. And I don't know about that word replace, so we just have to figure that one out. Thank you for the opportunity of the floor and the questions.
not turned up.
It's not turned up. There it is. Magic. Thank you. Thank you for what you said. That's common sense. It's common sense, and the word repeal, of course, is a key word there. As most of you know, Representative Gohmert has fought tirelessly against Obamacare since it was passed in 2009. And he will continue to use every means possible to repeal the law, because that's what he firmly believes needs to happen. Unfortunately, all the efforts to date to repeal or defund Obamacare have not succeeded, and the absolutely disastrous effects of the law are already being felt by Americans all over the country. President Obama has continuously misled the public on this law. It is now known that not everyone can keep their plans, and the costs for many of the people are absolutely skyrocketing. Congress has voted now 47 times to repeal all or part of the law. And in September, Congress continued the fight, but the Democrats and the president went so far as to shut down the entire government rather than have any delay or any repeal of the law. Furthermore, the administration continues to legislate from the executive branch, especially in regards to the Affordable Care Act. We saw this earlier where with just absolute wave of his hand, he delayed the employer mandate. And now facing backlash from being caught misleading the American public about their ability to keep their health insurance, he again legislated that this provision too can be delayed a year. Moving forward, the public will become keenly aware that Obamacare is an unfixable mess. We must continue to work as citizens to gain the necessary seats in Congress to eventually overturn the law. Unfortunately, until this happens, Obamacare will continue to hurt American families and the American economy. We have heard from countless constituents. We hear from them every single day in our office, as well as Americans from all over the country. We don't just get telephone calls from here in East Texas. We get calls from literally every state in the country. And we're hearing about all the harmful effects Obamacare is having on their families and their friends. Many just cannot afford to be insured anymore, and many would rather take the penalty than face the steep hikes. Many can't use the website that's required to obtain the coverage, and many individuals with pre-existing conditions, one of the president's major talking points in campaigning for this law, they're seeing massive hikes that they just cannot afford. I have a number of frequently asked questions that I put together that are questions that we are getting. And interestingly enough, it's the same questions every single day, so we've narrowed them down to just a few, and I wanted to cover those. But a couple of other things that I put together that I did want to share with you are some things that the congressman has said on the House floor. Many of you may have already heard him say these things, but if you'll indulge me just one more moment, let me share these comments with you. Regarding the subsidies, here's what Congressman Gohmert had to say about that. On January 1st, when millions of Americans will likely lose their employer's contribution to their health insurance, I will refuse to receive that same subsidy. It also means I will have to pay a substantial penalty or a tax, but I cannot in good conscience accept the subsidy when so many Americans have lost their insurance altogether because of Obamacare. We are supposed to be the servants of the American people, not the masters. House Republicans have voted for and sent to the Senate 2 different bills because we have been offering compromises, even to the extent of compromising with ourselves, because Senate Democrats and the president have refused to negotiate at all. They have made clear that they will negotiate with Russians and Iranians, but they will not negotiate with Americans. In the continuing resolution on which we voted Monday night, all funding is restored to the government takeover of Americans' health care, referred to as Obamacare, including funding of abortion. I could not vote for that resolution, though I am in agreement with the language ending government subsidies to Congress while Americans suffer without them. The president has given waivers or exemptions to hundreds and hundreds of his cronies, many businesses and some unions. I could not in good faith vote for a bill that provides even more funding for Obamacare when I have heard from massive numbers of constituents about the damage that it's doing. I will continue to listen to the people of my district, but the hue and cry is overwhelmingly from those who have lost insurance, had insurance costs become prohibitive, lost jobs, or have been moved from full-time employment to part-time because of Obamacare. And regarding the government shutdown and Obamacare, this is Obamacare related, of course, since it was at the heart of the shutdown. Congressman issued 2 statements regarding that. The first reads as follows. Representative Louis Gohmert issued the following statement regarding the Senate bill that puts off dealing with U.S. massive overspending and continues funding Obamacare, which at the same time continues the huge cuts to Medicare, in which the House voted on tonight. Tonight we voted on legislation that continues the massive overspending of money we do not have. This bill borrows even more money that will come out of the pockets of future generations of Americans, our kids and our grandkids. The bill permits all non-essential federal government workers to return to work with back pay and raises the limit on America's credit card to any amount the president cares to spend, so long as it is spent before February 7th. Unfortunately, the deal also fully funds and implements the disastrous Obamacare system that lowers the quality of health care and health care choices while costing more. The bill passed tonight does not protect people's religious beliefs. It continues to require people to pay for abortions in the Obamacare insurance plans, even when these people believe in their hearts that it is wrong. Though the president has previously announced he would not enforce the mandated penalties against big businesses for next year, he and the Senate successfully fought off our demand that we provide individual Americans with the same waiver provided to big business. I cannot in good conscience support such a bill that contains so much that the vast majority of my constituents do not support and that does so much damage to present and future generations. The second is about the congressman's staff, and time allowing, I'll come back to that because I realize that we're on a time limit here. But a couple of the frequently asked questions. Joanne, do I have time to go through these real quickly? The first one that we get every day, over and over again, are members of Congress exempt from Obamacare? The answer to that is no. Members of Congress have no choice but Obamacare if they want insurance through the federal government. However, earlier this year, the Office of Personnel Management in the executive branch allowed members to keep receiving the subsidies that they received prior to the implementation of the Affordable Care Act. Members still have to go on to the exchanges, however, they will continue to receive the subsidies. Congressman Gohmert said, "I find this to be an egregious injustice. Members should be treated as every citizen of the nation is treated. Furthermore, this is yet another example of the executive branch legislating as the subsidy was not including in the underlying text of the Affordable Care Act." Probably the second most asked question that we get in our office: why can't Obama be impeached for this mess? And the congressman's response that he wanted me to read to you, he saw these questions, and these are his responses that he gave to me. "This administration has continuously tested the trust of the American people. Executive overreach and scandal, as we've seen in cases such as the IRS mistreatment of Tea Party organizations, the delay of the employer mandate in the Patient Protection and Affordable Care Act, and the cover-up of Benghazi, among many other issues, have brought this mistrust upon them. I join in with my constituents in this mistrust, and I find that every action of this administration must be carefully scrutinized. Many in my district have raised the idea of bringing impeachment proceedings to the table. This important tool of Congress, used when a sitting president or cabinet member are convicted of treason, bribery, or other high crimes and misdemeanors, must be taken seriously. And I will keep that in mind as I continue to use all the powers at my disposal to fight this administration's constant overreach." Another question is, isn't it against the law for the president to change the Affordable Care Act without approval of Congress? If it is against the law for the president of the United States to change it, and he has done so, why isn't something being done about that? Yes, it has been increasingly frustrating to witness this administration continuously overstep their legal bounds. The president has legislated multiple times from the executive branch, and we will continue to do everything in our power to bring him to account for these actions. We have discussed this topic in multiple hearings and will continue to press the administration for their actions as we move forward. We will do everything in our power to stop this administration from overstepping its authority again. Another question, my doctor now refuses to take the insurance I've always had. What am I supposed to do? Well, unfortunately, until the law is repealed, the only options available are options that fall in line with the Affordable Care Act. The question's asked, how is Affordable Care Act affecting nonprofit organizations, specifically churches? Nonprofits and churches are affected in the same manner as small businesses. They are eligible for the same tax credits that small businesses are eligible for. They also have to meet the same employment requirements, and the same 50 employee penalties would apply to them. Is there some sort of break for people who are self-employed? Premiums and deductibles have tripled, and we can no longer afford our coverage. Unfortunately, no, there are no different set of rules for the self-employed. Are there any statistics on how many illegal immigrants may be registering for the Affordable Care Act? And the congressman said, no, illegal immigrants are not legally permitted to register for the Affordable Care Act. Policies that are being grandfathered in. Your insurance policies, if you've been told that you get to keep your insurance policy because it's grandfathered and you've had it for a period of time, will they be dissolved by 2016? Yes. In most states, the grandfathered plans run through 2015, and insurance companies will notify clients of the change in 2015. In some states that have set up their own marketplace, such as Washington, the plans only run through the end of 2014. In Texas, however, the plans will be dissolved in 2016. Are you keeping your insurance, asking this of Congressman Gomer, or are you going into the exchange? In order to receive insurance through the federal government, I would have to go on to the exchange. However, I disagree with the aforementioned decision by OPM to grant members of Congress subsidies for their insurance, and will look into other means of obtaining insurance for myself and my family in the same manner that all Americans have to. I do not believe in the unfair, unconstitutional subsidy that OPM granted. Everyone should be treated equally under the law, and the underlying legislation contained no provisions for this subsidy. The question was asked, what is being done to protect identities of people who do go online and register for the Affordable Care Act? We continue to have oversight hearings regarding issues such as this. The Affordable Care Act's website has been riddled with problems, including various reports of possible security breaches. The President and the HHS Secretary, Kathleen Savalas, continue to ensure us that they will be resolved. But we have seen no improvement on any front. We will continue to monitor these situations closely. We know there is a fine, actually, it's a tax, but will there be possible jail time for people who do not register for the Affordable Care Act? No, there's no possibility of jail time for people who do not register. If the Affordable Care Act is supposed to be so affordable, why the high deductibles that no impoverished person can pay? We get this question every day, and in fact, I had a conversation with a woman earlier this week who was calling from another part of the country and was telling me how excited that she was that she has now insurance for herself and her 2 children. It was going to cost her around $100 a month. And I asked her what her out-of-pocket expenses would be, her deductible. And she became very angry, and I deduced from the conversation she didn't understand what a deductible was. And when I told her what she would have to pay out of pocket, she screamed at me, no, it's free. I don't have to pay anything else. You're wrong. And she hung up the phone. So there's an education gap there that folks are not understanding what it is that they're buying. But back to this question, if Affordable Care Act is supposed to be so affordable, why the high deductibles that no impoverished person can pay? This is an issue that we have seen time and time again with Obamacare. The very people it promised to help, it hurts. The people it promised to leave alone, it hurts. The more we learn about the ramifications of the law, the grimmer the picture that it paints. The law is set up to fail, and it will continue to cause hardships on people until we repeal it. We will continue to do everything we can to see this goal through.
I've got a sneaking suspicion that some of you are on Medicare. And you might be wondering, well, Obamacare doesn't have much to do with me. I'm on Medicare. I'm set. No big deal. But I've also got a sneaking suspicion that you folks on Medicare pay taxes in the state of Texas. And if you do, you need to understand that a big part of Obamacare and the whole plan was to expand something called Medicaid in the state of Texas, which a big portion of that comes from the tax dollars you send down to Austin. Medicare is something that over the years you paid into, came out of your paycheck, you saw that line on there, something you paid into, and workers out there are paying into that now. Medicaid is different. Medicaid primarily helps people that are in nursing homes who don't have the assets or the income to take care of themselves. And it helps very poor people and children with health care in the state of Texas. That's Medicaid. And that is a state-run program where we get some matching money from the federal government. Part of Obamacare, it depended upon the states expanding their Medicaid rolls. What that meant was that if you wanted to be on Medicaid, you were someone who was poor, you had to meet an income level and assets, so not just your income, but what you owned at this level. Obamacare said, we states, we're going to give you some money if you'll expand that to people at a little bit higher income level, but oh, by the way, don't check their assets. Just check their income, okay? And we're going to give you a significant amount of money matching for that. But the money's going to run out in a few years. We're going to the federal government would slowly draw back on the amount of money it would give the states, federal money. Now, I don't know about you, but I'm tired of using the word federal money. It's not federal money. It's your money. It's my money. It's the money that the federal government has borrowed that our children and grandchildren are going to have to pay back. That's what we call federal money. So just wipe out the distinction as far as I'm concerned. So there was enormous pressure when I was down in Austin for the state to go along with what's called Medicaid expansion. Obamacare's effort to get all the states to increase their enrollment for Medicaid, which is a very, very expensive program for the state of Texas. And when we looked at the numbers, what it was going to do was cover a few people for a lot of money. And in time, the federal government was going to have to keep its promise to be able to send us all of our own money back. And it's Medicaid, as the doctors will tell you, is a program that doesn't work very well for doctors, and it doesn't work very well for patients. One of the problems that we talk about a copay. How many of you have a copay on something that when you go to the doctor's office, okay? People on Medicaid, by and large, don't have a copay. So they can go to the doctor's office, and they don't even pay the cost of a McDonald's value meal for a doctor's visit. Now, I understand there are some people that can't pay anything, and we ought to have a way to help them. But if you've got an iPhone and cable TV at home, I think you ought to have to pay the cost of a McDonald's value meal when you go to the doctor's office. And oh, by the way, you ought to have to prove to us that you don't have a house and land and bank accounts. You ought to have to prove your income. Obamacare said you wouldn't have to do that. So we had this choice from the federal government, basically, hey, we're going to give you this baby elephant. And we're going to give you enough feed for this baby elephant until it's about a teenager. But then we're cutting off the funds, essentially. And you're going to be left with a full-grown elephant. And you got to find the feed for it. And we said no. But let me tell you, there were Republicans down in Austin that were more than willing and were actually pushing us to do that. And it took a concerted effort more than once for us to block Medicaid expansion in the state of Texas under Obamacare. But we did it successfully. We also had to resist efforts to pass a bill to legitimize the Obamacare navigators, which we're all hearing about now in the news, and many of them are dishonest. We resisted that effort. But let me tell you, there is going to be an enormous amount of political pressure going into even the next legislative session in 2015 for Republicans to expand Medicaid in the name of helping the poor and, babies and children and mothers and everything good, right? But here's the problem, folks. We don't have flexibility under Medicaid as a state of Texas. We don't have the ability to say, okay, if you can't afford an iPhone and a nice new vehicle and to pay for your beer with cash and your food with food stamps, that we're going to do a little means testing and require you to do a copay. We don't have that flexibility from the federal government. We've asked for that. We have gone to the Obama administration and say, if you're serious about Medicaid and helping the poor, let us have at least the flexibility to manage our health care needs in Texas the way we feel best. Our population and our environment here in Texas is different than it is in Connecticut, okay? We live on the border. We have issues that they just don't have up there. We want to have a system that has the flexibility to handle it and be compassionate. As Dr. Graham talked about, every Republican I know in elected office is truly compassionate and truly wants to help those people that have a pre-existing condition they would never be able to afford to get health insurance on their own. We have ways that we can help those people, but the federal strings have not allowed us to do that in a way that is sustainable. Folks, if we don't have a way to pay for it, in the end, nobody's going to get helped. That's the problem. When we're out of money, it's time to think. When you're out of money, it's time to think. And there's a lot of smart people in Texas who would like to address this problem. But the federal government has refused time and time again to say, state of Texas, here's the money we've been sending you. We're going to give you a block grant, and we're going to allow you to adjust your rules to help your people in the way you best know how. And let me tell you, we can do it better in Texas than in a lot of places. We've got some smart people here that can figure it out. We all saw how this whole rollout of the ObamaCare has just been an utter failure. But the warning signs were there all along. Early on in the legislative session down in Austin, I sat in on the insurance committee, and our longtime committee chairman, Republican John Smithy from Amarillo, was asking questions from one of the top Texas health the Health and Human Services Commission bureaucrats, okay? So one of the ladies that was one of the top policy experts that helps run healthcare in Texas for the government. And he was asking her about how are these exchanges working? How is this going to work? How the individual? And she was saying, we don't know. We don't know. And I'm sitting there thinking, oh my goodness. If some of the two top public officials in the state of Texas are here in a public hearing back in February of this year, with this thing coming just a few months away, they don't have a clue what the federal government's going to do. We're in big trouble. And then Chairman Smithy asked he made some very important statements. He said, we have repeatedly asked someone from the federal, from Kathleen Sebelius' office, to come to Texas and testify. Let us ask you questions. Come down here and give us some answers. From our government in Washington to come to Texas, one of the largest states in the union, and answer some questions about this. And the response was, we can't even get them to show up. Now, can you believe that, folks? Yeah. The Obama administration would not even send someone down to Texas to be held account and to answer straightforward questions. Maybe we could have done some different things as a legislature to help protect and preserve our situation here. But they would not even share that information with us. You go back to trust. I don't trust what they're doing up there. I think the emperor has no clothes. So as we move forward and Washington's going to do what Washington's going to do. And I am not optimistic that they're going to get it resolved anytime soon. But what we're going to have to do down in Austin is we're going to have to find creative ways to do what we can with what we've got. And at the same time, fiercely resist expansion of Obamacare into state government and into your pockets.
Representative Schaefer, this one is for you. If Medicaid is a state program, why not impose a copay for Texas Medicaid enrollees?
Yeah, I'll answer it again. For 95% of Medicaid enrollees, when we take the federal money as part of the matching, so Medicaid runs as a match. Federal government sends some money, the state puts in money. In order to get the federal money, you have to abide by all the federal rules. And the federal rules will not allow us to charge a copay.
And if you guys have already gone over something, since I got a question, it's obvious that somebody had wanted a little bit of an expansion on it, so I'm going to ask it anyway. Okay. Representative Schaefer, explain what block grants are.
So a block grant, in this case, like for Medicaid, would be taking money that's sent from Washington. Okay, if Washington has passed a bill, passed a law up there, says we want a program to help poor people, and we're doing it through Medicaid, but you've got to have our rules. A block grant would be, Texas, you come up with the rules, and we'll send the money. Okay, so it's basically a block grant means the federal government cutting those rules and giving us flexibility. A block grant is a flexibility tool for the state of Texas.
And I want to add to that just a little bit. Do you all know that Rhode Island got a block grant? They are able to manage their Medicaid dollars the way they see fit. I'm going to ask you a question to just ponder. There was a time when Republicans held the White House, held the U.S. Senate, and held the House of Representatives. At that same time, we had statewide GOP leaders in Texas. Inquiring minds like me want to know, why the heck didn't we ask for the block grants when we had the votes to get it? See, this is the issue. When conservatives say they're in charge, they don't take the reins of power and put the government back on the side of the people. All right, that was my editorial comment for this segment. This person says, I have heard that if you need joint replacement, that Medicare will not cover it under Obamacare. Does anybody know the answer to that? Are we sure that it would be covered? We don't know. We have physicians that are saying they do not know.
What I do know is that they've added hundreds of new codes for all sorts of unbelievable things that they're going to cover. But as far as the joint replacement, that I really don't. I'm not sure anybody actually knows the answer to that, actually.
And there will be panels.
There will be panels.
Okay. Is a durable, portable, willable health savings account a good idea? Willable means you could, if you have the account, you could pass it down to your heirs. Even transferable within a family could be a good feature. Do you all agree?
I'll take that question because I think that is one of the most important things that a family can do is a health savings account because it is yours. It doesn't belong to the government. It belongs to you, and it is portable, and you can will it to whomever you want. So you're going to go to the doctor, and you're going to have a colonoscopy. You negotiate with Green. Say, okay, I got $100 here. How much does a colonoscopy cost? Well, it costs $200. Well, let's negotiate because I've got Green. Well, let's see what can we do. It's your money, and you're going to take care of it. You're not going to go to the doctor for a sniffle. You're going to take care of it at home with Tylenol or Afrin or anything else. You will be careful how you use those dollars because they're yours, as opposed to Medicaid. You go to the doctor 15 times in 1 week if you want, and it doesn't cost you a penny. So you abuse it. I think health savings account is the most important thing that we can do in this country.
I have an unemployed, dependent daughter in her 40s. Her health insurance was in the Texas pool for the uninsurable. It has been canceled. What can I do?
Let me speak to that. Is it on yet? Yes. Okay, so Texas has had a high-risk pool. And, part of Obamacare was basically going to phase out these high-risk pools in order to move these people into Obamacare. I'll tell you, Lieutenant Governor Dewhurst came out very recently saying that Texas ought to keep open its high-risk pool. And I think there's some value in that conversation. I don't know the mechanics of it yet, but if there's a way that the state of Texas, a high-risk pool means taking people that are in very unfortunate situations and putting them into a situation where they can get some financial assistance through the state of Texas, through their insurance company, then we should do that. That's how you can be compassionate through your tax dollars. That's a Texas solution, and that's what we ought to try to do. I don't know what's going to happen to this individual that asked the question, but in Texas, we want to try to preserve that tool.
Thank you. Prescriptions are already being impacted. One of my generic medicines went up significantly, and when I called the pharmacist, he said companies are raising prices now because Obamacare will set limits on pricing. And this person said, holy cow, that's lousy.
Anytime you take money from your money back from the government, there are strings. And you're going to pay one way or the other. And the drug companies will be raising and have been raising prices, as have the people who are in durable medical goods, the walkers and the other things that you use if you have problems. So this is a major problem, and it's all going to go up.
Some large hospitals are being excluded or are deciding not to be included in the exchanges. What is going to happen to those hospitals? Will they be forced to close?
They probably won't be forced to close, but they're going to be forced to raise their prices because most of those institutions have been receiving funds from Medicare, Medicaid in the past, and therefore they will not have patients that are going to be eligible. So those who are on some other form of pay or have chosen not to enter the system will still be going to those hospitals, or they'll have to in order to get their care, and the hospitals are going to have to just raise their prices more.
What we've got here is a rolling disaster, and it's terrible. This is a very good question. For those of us in the healthcare professions who have taken oaths to care for and protect life, what are your thoughts on how we might conduct ourselves with the increasing pressures of Obamacare against the very lives of those we have pledged to protect, such as care of the elderly, physically and mentally disabled, or difficult diagnoses?
First, do no harm. Okay? The majority of physicians became physicians because it was a calling, because it was a need, because it was inside of our hearts, because we wanted to care for people. The majority, I'm not saying all of them, but the majority of physicians are healers, and that's what we want to do. When you take situations of the mentally handicapped, and that includes a whole slew of patients, Down syndrome children, the elderly, you take a great-grandmom who's in bed, who's been in bed for 5 years, doesn't know who is who. Those are questions that need to be taken care of very, very locally between the family and the physician. However, There are going to be panels. There are going to be panels in Obamacare. We all know that already. Those situations shouldn't have to be taken care of by panels. There should be a conversation between the physician and the family, and that's how those problems should be taken care of.
Representative Schaefer, this one is for you, and I'll just broaden the question a little bit. To your knowledge, were there any statewide officials who wanted to push for Medicaid expansion? And the second part is, who led the fight to stop Medicaid expansion?
To my knowledge, I don't have any. It never came across to me that the statewide elected officials were trying to push Medicaid expansion publicly. If they did so privately, I don't know. I think Rick Perry was pretty clear on that. I can't speak for Speaker Strauss or David Dewhurst on that, but I know in the House it was primarily the freshman Republicans who were involved in making sure that Medicaid was not expanded. I can tell you one of my good friends, Jeff Leach, was involved in a floor fight on that where we supported him. That's right.
Thank you. And I can tell you from my perspective of being down there in Austin every other week for like seemed a lifetime. The Republicans, the freshman Republicans, were the stalwarts. Now, there were some returning sophomores, like, for example, David Simpson, of course. Brian Hughes didn't want to expand it. But I can tell you that there are some GOP, some of them physicians, in the House who badly wanted those federal dollars. And they were looking at every way possible to skim off enough Republicans in the House to unite with the Democrats in order to get that passed. And I will tell you that that's one of the issues that the statewide organizations like Texas Public Policy Foundation, we've had Arlene Wolgemuth here to speak to you all about the healthcare situation and some of the solutions that Texas needs to look for. Empower Texans, Grassroots America. I mean, we were there, at all times watching those bills and saying to the squishy members, if you vote for it, we're going to look at it just as if it was a tax increase. Because usually if you put it to them like that, they kind of get the picture.
Joanne, I want to amend my comment that there were more senior Republicans in the House that were involved in opposing that. One in particular was Chairman Kolkhorst, a lady out of Brenham, who is chairperson of the Public Health Committee in the Texas House, and she was very articulate and very reasoned in her defense of not expanding Medicaid.
Right. Is the federal match enough to overcome the waste built into their rules for the states?
Not at all. In fact, one of the scariest aspects of it was the fact that they said you can only ask their incomes, but you have to stop asking about their assets. There are attorneys who have built a practice around helping people shield their assets so that they can get into a nursing home. And that's under these pre-existing Medicaid rules. So Obamacare said states expand Medicaid, but you don't even have to worry about asking about assets. So you can take someone you can have a very small income if you've got your house paid for and some CDs, stored away and some wealth. So somebody like that could actually be eligible for something meant for the poor under Obamacare. How smart is that, folks? It's just not smart.
Are there any options for citizens who are too young for Medicaid, they mean too young for Medicare, but cannot afford any health insurance?
I think that's what we're talking about is our options. What are our options? Being able to purchase insurance across state lines, being able to use your own money in health savings accounts. Two very, very big things that need to be done. This is the fight we're having.
That's exactly right about that. If you can't afford it, if you can't afford the premium, the low premiums, supposedly low premiums, how are you going to be able to afford the deductibles and the co-pays that are inflicted under the Affordable Care Act? You just can't do it. Of course, as we've been talking about Medicaid, there are some resources like that. And getting back to the person who asked about the 40-year-old dependent child, of course, you've got Social Security disability and things of this sort that you could consider. If you want to call our office, we can talk to you a little bit more about that. But there are some resources. We also maintain a list in our office as far as indigent type charity organizations that are out there to help individuals. But therein lies the problem. If you can't afford the premium, you can't afford, these people are going to go to the doctor and they're going to realize that they're going to have to come up with $6,000 out of their pocket, and they're not going to be able to pay for it, period. They just won't be able to do it.
In Tyler, we have Bethesda Healthcare Clinic, which is a wonderful clinic for those who don't have a lot of funds. There are many clinics of similar nature in many other areas within this state. You also have, I did 20 years in the emergency room. We were the ER, we were the family doctor for a substantial portion of Tyler, Texas. Obviously, many of them were Medicaid, many of them were no pay at all. They had nothing. When they were sick, they still got admitted, they still got taken care of. Ultimately, they either got access one way or the other into the payment system through Medicaid or something else, but nobody was turned away. The idea that these people have no source, no means of health care is a fraud. They do have a means of health care. It's not optimal, but it's a means of health care. Nobody really gets left out.
Why were so many physicians never concerned about cost until it hit their pocketbook? Part 2. When will you be able to receive a bill at the doctor's office and know the charge for your doctor's visit upon leaving the office?
I don't even want to answer that question, but I will. If someone comes to see me in my office as a specialist and I bill $300, let's just say, I'm just going to throw some numbers out. Let's just say I bill $250, $300 for my consultation where I have to decide whether somebody needs to have some type of surgery. Then Medicare decides, well, yeah, I'm not going to pay, it's not worth the $300 or the $250. Let's just give her $125 for that visit. And then you only have to pay 80%, and the other 20% should come from the pocket. Now, many people, including my mother, thinks that you've got your Medicare and then you've got your supplemental, that the supplemental makes up that difference. So I charged my $250, and Medicare gave me, it's not even $125, it's something like $95 or something like that. Most people think that the difference between $250 and $95 is supposed to be paid by the supplemental, but it's not. It's not at all even close to that. If Medicare says that only $95 is all that I'm worth for that you're allowed to give to the surgeon for her consultation, then your supplemental will only pay 20% of $95, not of the $250 that I should be getting paid, if that is what I'm going to bill for a consultation to make a decision, etc. So there's a really big misconception, and Medicare pays whatever they feel like paying. I can take a patient from beginning to end for 90 days and diagnose them, do the workup, see them multiple times, take them to the operating room, spend multiple hours in the hospital with them and in surgery, take the responsibility and the risk of doing that. I have used my judgment to that and follow them for the next 90 days, and I might get $350. I might. This is for a big, major operation. So you guys really have a misconception about what physicians are making. Now, many of us have invested well monies that we have, or family money, or sometimes the spouses have money. Okay, but there's a real big misconception about what we really are getting reimbursed. And it's not what you think. I think many times my plumber really, really does make more money for something than what I make.
Certainly does per hour.
At least per hour, that's correct.
Well, and Margarita, in defense, part of this is about the class warfare
No
that has
question
gone
about
on
it.
in this country. Because I'm going to tell you, if I'm going to a doctor and being consulted with a physician regarding surgery, I want a surgeon to be talking to me about it. I don't want the plumber talking to me about it.
Or the PA, the physician assistant, or the nurses. And that's what we're going to start getting more and more, because a lot of us are leaving the practice. And a lot of us aren't going into the practice. So it's you're right, the class warfare. So what if I took 17 years of my life to become a surgeon? So what if I want to drive a Mercedes? So what if I do? Is that wrong in America? But it really isn't that.
Okay, we're running out of time here. Here's a good question. How is a health savings account any different from a regular savings account? Who wants to tell me?
It's a tax deduction.
The difference is you can spend your savings account on anything you want to spend it on. You can spend it on a trip to Disneyland if you want. A health savings account can only be spent on health care related expenses.
And it's also tax deduction.
And it has some tax benefits.
And you all have to understand too, any of you that don't have a flexible savings account, a flexible spending account, or a health savings account, your physicians and your insurance company are mandated by the federal government to follow that all the way out to make sure that you didn't go buy a Gucci purse with your health savings account funds. I know because I have to, and you would not believe what it takes for an individual to get their own money out of one of those accounts to pay a bill. I mean, and the federal government has just made, look, let's face it, they always want us to be more accountable with our own money than they are accountable with our money.
And Joanne, if I can interject as well, the congressman has long been a proponent of health savings accounts, and in fact, that's the product that he was looking at for his family. But early on, when all of this discussion started years ago, that was one of the things that he and a number of other members of Congress were supporting, was a mass rollout of the health savings account plan. And you have a card that you are given that accesses your health savings account when you go to the doctor, and you use that card, and it is tagged and labeled and flagged. You can only use it for approved health-related expenses. So this is something that he has been talking about for years.
Okay, we've got one statement and we got one final question. Here's the statement. I am a cancer survivor with Medicare number 1 and TRICARE number 2. My surgeon, his physician assistant, and his bookkeeper spent 10 minutes on the phone making my procedure match the money I have on Tuesday. Question. Why would the government want to kill off a taxpayer? If I like my cancer, I can keep my cancer. Okay, let's see. I believe the Obamacare mess we're in is intentional. Medicaid is a single-payer system. I believe Obama wants to eventually force us all into that system step by step. How can we stop this slide into single-payer?
Repeal. It's the only answer to that. And don't allow them to come up with a similar plan.
No replace.
No replacement, just repeal.
Okay.
The other aspect of that is that they'll never get that far without cooperation from the states. And as long as the states, like Texas, can resist going that direction, then I think we can help delay that or prevent it.
But we're going to elect some really good, strong conservatives to lead the state before we do that. Okay. Don't y'all think this was a good program?